So this is a quick review of a study which was done for osteopathic treatment for chronic migraine. It was published in the Journal of Complementary Therapies in Medicine, and it was a three-armed randomised controlled trial, which is randomised controlled trial is considered the gold standard in trying to determine whether a treatment is effective. In this particular study, they took people getting chronic migraine and randomly assigned them into treatments of just getting medication, or getting medication and osteopathic treatment as well, or getting medication and having a sham osteopathic treatment done to see whether the osteopathic treatment was actually effective for this problem. So let's see what they found. So the study was done there in Ancona, Italy, and to get the to be in the study, you needed to have 15 migraines a month, which is quite a lot, and you needed to be getting them for at least 12 months, which is quite a long time. They excluded chronic illness and other treatments which might be getting the improvement as well, and any history of psychological signs which may also play into the results. So there were 105 people who fulfilled those criteria, and those 105 headache sufferers, migraine sufferers, were broken into groups of 35. The first group received only medication under the care of a neurologist. The second group were under the care of a neurologist, but they also had osteopathic treatment done. And the third group had a sham osteopathic treatment where there was a pretend examination and there was a pretend treatment. And interestingly, from that group, they did it pretty well because no one in that group thought that they were in the sham therapy. They all thought that they were getting the osteopathic treatment. So they had 8 treatments in 6 months, which is quite a long period of time and a reasonably sparse number of treatments. And the techniques have fancy names, and they're listed there, but basically they're all indirect techniques. So a lot of people perceive manual therapy to be massage and manipulation and stretching and pushing on the sore bit, and pushing into it until it releases. But these techniques were all gentle techniques and allowing tissues to relax off by themselves. If you want more of an explanation on an indirect technique, there's a video on it on the migrainesolutions.com.au website if you want to check that out. So the results. So what did we find? So in the 6-month period, which is 24 weeks, we had no change in the number of migraines from just the medication group. So started at 22 migraines a month, ended up still getting 22 migraines a month after 6 months. In the placebo treatment, there was actually a little bit of improvement. It got down to about 18 migraines a month there, just from the pretend treatment. So, was it placebo? Did they actually do something in there which maybe loosened something off, which released neck tension? We don't know, but interestingly, when they had the actual osteo treatment, we got down to an amazing 1.2 migraines a month from 22, which is a 95% reduction in migraine frequency over that 24 weeks, over that 6-month period, which is quite an impressive reduction. So we've gone from this number of migraines a month to this. And the number of people taking medication, so OMT is osteopathic manipulative therapy, was actually 80% reduced. So we got down to 7 people, down from 35 were taking migraines. The sham treatment, once again, had a little bit of improvement. A few people got off their medication, which is great. But on the control group, from only taking medication, there was no change in the reduction. There was no reduction in the amount of medication taken over the 6-month period. So we went from this number of people to this number of people taking medication. And the conclusion was that osteopathy as an adjunct therapy may, number one, decrease the amount of medication that people were taking, and 2, could really optimise the clinical management of this situation. And it was said that osteopathy may be considered a valid procedure for the management of migraines. So that study reproduced similar findings that were found in an earlier study where they found that osteopathic treatment for migraine sufferers decreased pain and decreased disability scores and increased the quality of life for migraine sufferers. So it's always good to reproduce studies because the more people you can test with something, the better, obviously. So if you want some more information on migraine prevention, particularly drug-free, ways of preventing migraines. There's a free ebook for 7 Secrets for Migraine Prevention. You can download that from the Migraine Solutions website. And we also do free talks, free one-on-one consultations for anyone interested in this topic. So there's a review of a study on osteopathic treatment for chronic migraines.
migrainesolutions.com.au